Is your daily soundtrack shaping your future memory?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're looking at how simply listening to or playing music may help you lower dementia risk and support sharper thinking as you age. I'm Ethan Foster. A large study of Australians aged 70 and older links everyday music habits with meaningful reductions in dementia and cognitive impairment. We're going to translate those numbers into a routine you can start now.
I'm Alara Sky. You'll hear how listening and playing engage multiple brain regions tied to memory, movement, and emotion, why benefits show up on tests, even when you don't feel mentally sharper, and how to build a calm, personalized practice you can sustain.
Let's start with the scale of the problem. In the U.S., about 7.2 million adults 65 and older are living with Alzheimer's disease, the most common form of dementia, and that number may approach 14 million by 2060 if nothing changes. Healthcare costs are projected at $384 billion in 2025, with unpaid family caregiving valued at over $400 billion. With no cure, lifestyle strategies that delay symptoms matter.
The new data come from the ASPRI and ALSOP cohorts, which followed 10,893 Australians who were dementia-free at enrollment. Researchers tracked how often people listened to music or played an instrument, then followed cognitive outcomes. The aim was to see how these habits related to dementia, cognitive impairment, no dementia, and specific thinking skills.
Listening stood out. Participants who always listened to music had a 39% lower risk of developing dementia and a 17% lower risk of cognitive impairment compared to those who listened rarely or sometimes. They also maintained higher scores in global cognition and memory, which support day-to-day tasks like recalling events and making decisions. Attention and language scores didn't budge.
Playing an instrument helped too. Older adults who often or always played had about a 35% lower risk of dementia, though this wasn't tied to reduced cognitive impairment or improved test scores over time. The signal is positive, but the effect was less consistent than with listening.
Combining both activities, listening and playing, delivered additive protection, a 33% lower dementia risk and a 22% lower risk of cognitive impairment. The authors emphasize that causation isn't proven, but the accessibility of music makes these findings practical for daily life.
Education level influenced results. People with 16 or more years of education saw the strongest protection, suggesting that higher cognitive reserve may amplify the benefits of music engagement. Those with 12 to 15 years showed mixed results, which underscores how background factors can shape outcomes.
Another key point, perceived sharpness didn't improve even when memory and global cognition scores did. You might not notice a change, but objective measures can still move. That gap argues for sticking with a routine long enough to capture benefits you may not feel day to day.
Why does music help? When you listen, your auditory cortex, limbic system, and motor cortex engage simultaneously. This whole brain activation supports memory networks, emotional regulation, and movement pathways. In recovery settings, rhythm and melody can even retrain speech after stroke by tapping alternate circuits when standard therapy stalls.
Music also calms the body. Slow, steady tempos signal your parasympathetic nervous system, the rest and digest mode, lowering heart rate, easing muscle tension, and reducing blood pressure. Beyond immediate relaxation, studies link musical engagement with lower odds of mild cognitive impairment or dementia, potentially through better executive function, plasticity, sensoromotor repair, stress reduction, and social connection.
Benefits extend to people already living with dementia. In long-term care residents, individualized playlists, distinct from generic background music, reduced agitation, shouting, and irritability during and after sessions. Familiar songs appear to anchor attention and soothe behavior more effectively than non-personalized options.
There's also a neurological anchor in the medial prefrontal cortex, a region strongly activated by familiar music, and one of the last to deteriorate in Alzheimer's disease. That helps explain why a single song can unlock vivid autobiographical memories and reinforce a sense of self when other cues fail.
If you're ready to build a routine, consistency comes first. Make time for music daily, listening, humming, or playing a simple instrument. Start small and grow gradually. The goal is regularity, because the biggest benefits were seen in people who engaged consistently rather than occasionally.
Personalize your playlist. Choose songs you naturally hum or would dance to, especially from earlier life stages. Familiar tracks can spark memories, reduce anxiety, and improve mood, which makes sessions more effective and easier to sustain over time.
Set the environment. Use a quiet room, a comfortable seat, and your preferred listening method, speakers or headphones. Keep volume comfortable and avoid sudden changes in loudness or tempo. Short pauses between songs help prevent overstimulation and keep the experience soothing.
Add gentle activity and social connection. Once listening feels easy, layer in tapping a beat, humming or singing along. Joining a choir or community music group pairs cognitive engagement with social interaction, coordination, and routine, factors associated with stronger aging trajectories.
Review and refine weekly. Note which songs felt best, whether sessions ran too long or too short, and whether the space was comfortable. Keep what helped and remove what caused stress. This brief audit raises the odds you'll stick with the plan.
To place dementia in context, remember, it isn't just aging. Dementia is an umbrella term for cognitive decline, severe enough to impact daily life. Alzheimer's is the most common type. Disease processes can include protein plaques and tangles that damage neural communication, progressively affecting memory, reasoning, and language across stages. Age, family history, vascular health, inactivity, poor diet, and social isolation can increase risk. Another reason a low-barrier habit like music deserves a place in healthy aging strategies.
Public health researchers recommend integrating music into risk reduction efforts. Encourage adults to sing, re-engage with instruments, and participate in group music. These activities combine cognitive challenge, emotional reward, movement, and social ties, elements that may help keep your brain resilient over time.
Here's your challenge. Today, set a 10-minute appointment with yourself to listen to 3 personally meaningful songs at a comfortable volume in a quiet space. By week's end, expand to a 15 to 20-minute session, add light humming or tapping, and shortlist one local choir or community music group to explore. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.